In practice, we see situations where women come, we make a diagnosis, we treat them, and they ask you this question: what about my husband? Good day, everyone. My name is Ibrahim, well at Hospital Abuja. And in the series of our health talk today, we'll be talking about one other very common things. We choose to talk about these common issues, health issues that we feel in our practice people have some misconceptions about, and we want to make efforts to clear some of these misconceptions and then give appropriate information on such. So today we'll be talking about urinary tract infections. Here we're talking about urinary tract infections in both male and females. Simply it as UTI. Urinary tract infections are very common, okay? However, they are much more common in females than in the male. And urinary tract infection simply means infection in the urinary tract. Now, when we say infection in the urinary tract, the human urinary tract has different parts. Starting from outward inside, we have this small tubing or passage that we call the urethra, where urine comes out from the bladder. Next to the urethra, we have what is called the bladder, that is the urine tank, more or less, that there where urine is stored before we go to wee or we feel the urge to wee. Then next to that, there are these small pipes that bring urine into the bladder itself. They are called the ureters. And then we now have the factory itself that produces the urine, which are the human kidneys. So therefore, the urinary tract consists of 4 parts. The outer part is the pipe that conducts urine outside. We call it the urethra. The bladder is next, then the ureters are next, and then we now have the kidneys. Now, why this is important is when we talk about urinary tract infection, it can affect any part of these 4 parts. So we divide it into 2 parts: the lower urinary tract, upper urinary tract. Okay, so the urinary tract has, as I said before, it's divided into upper and lower urinary tract. But for clarity, we'll just simplify it as meaning the lower part is the bladder and the urethra, the upper part the urethra and the kidneys. Now, any one of these parts can become infected, but almost always urinary tract infection starts from the lower part and then goes up all the way to the kidneys, and so therefore it is described as ascending, that is from the lower part to the upper part of the urinary tract. How do we contract urinary tract infection? There are 2 possible ways. One is spontaneous ascension of organisms, meaning, okay, for some reason a bacteria finds itself in the lower urinary tract, the outside where urine comes out, and then that bacteria ascends all the way to the bladder. From the bladder, it multiplies there, then goes all the way through the ureters to the kidneys, and sometimes from the kidneys it now spreads to the rest of the body. So most of the time, that is spontaneous urinary tract infection. There are factors that may encourage that happening, and these factors are more commonly occurring in women than in men. And so generally, women or females are more susceptible to that spontaneous urinary tract infection because of various factors. Just to make it simple, the way a woman cleans herself when she goes to her stool can predispose her to urinary tract infection. For instance, if a woman cleans from back to the front, that is back to the front, there are usually natural organisms in the human feces, most of which are the commonest causes of this infection. So if you clean from backwards to the front, you somehow smear bacteria to the front. And in women, the opening where urine comes out through, if the bacteria gets into that place, it will there can have entrance or access to the small pipe that conducts urine from bladder to the outside. We call it the urethra. Now, there are certain factors that may aid its ascension, one of which is sexual activity. Please, we want to emphasize here, urinary tract infection is not the same as sexually transmitted infection, because again, people commonly mistake that. In practice, we see situations where women come, we make a diagnosis of urinary tract infection in them, we treat them, and they ask this question: what about my husband? In most cases, we tell them no, their husband has nothing to do with this, in the sense that it is this organism in you didn't come from your husband. But where your husband may play a role, or your partner may play a role, is in pushing it further. If it was just around the urethra or the opening where urine comes out. In fact, there is this concept of honeymoon cystitis, okay, where women come down with urinary tract infection from honeymoon activities. So basically, when the organism finds its way around the opening of the urinary tract, it can ascend, either pushed by someone or it just spontaneously ascend. The other habit that may encourage that happening is poor intake of water, and therefore poor urination. So sometimes if we don't drink water and urinate frequently, the organism stays there and then climbs. As long as urine is not flowing out, urine does not wash it down, and so it can have time to multiply and then therefore ascends further. The other habit that encourages that to happen again is holding urine for very long time. Unfortunately, I think women or ladies are more in the habit of doing that for reasons of finding convenient social environment to wee. Most ladies will rather hold their urine for hours because they fear that when they go to dirty toilets, they get infection, which is not actually true. Alright? It is better you go and wee in the dirty toilet than hold your urine for hours, because by holding your urine for hours, you're actually predisposing yourself to that thing you want to prevent by urinating in the dirty toilet, so to say. So it is actually better you form the habit of urinating more frequently rather than holding your urine, because when you do that, you encourage urinary tract infection, ascension of the organisms. The other thing that seems to also encourage that happening, the urinary tract, or facilitate the process, is pregnancy in women. When a woman gets pregnant, there are what you call anatomical and then physiological reasons why she becomes more prone to urinary tract infection. So men, on the other hand, don't have some of these risk factors that predispose women to a urinary tract infection, as it were. The reason is because their structure is slightly different. In fact, that little pipe that conducts urine from the bladder to the outside in the men is longer, and before, even if a bacteria enters where urine comes up, before it gets to that place, it takes it a while, and the man may have urinated separately. And so for a woman, the distance is just about, the length of the urethra is just about 3 centimeters. So it's very short. And so women, by anatomy, by structure, by nature, they are more predisposed to this infection much more than men. There's spontaneous that. So the other way people get urinary tract infection is when they have medical procedures that warranted introducing things into the urinary tract, like what we commonly do when people want to undergo surgery. We call it catheterization, or we just put a plastic device in the urinary tract so that the patient or the individual can wee in his or her unconsciousness, so that he or she will not soil his or her beddings and all of that. So we introduce that catheter. Now, introducing a catheter into the urinary tract constitutes a foreign body presence. And usually once we have foreign bodies in the urinary tract or anywhere in the body anyway, you have a predisposition to urinary tract infection, because the organism simply use that foreign body as a ladder to get access to the other part of the urinary tract. So for both men and women, once they have medical procedures that's required introducing anything into the urinary tract, there's a risk of contracting urinary tract infection. And what are the things that you feel? How do you know you have urinary tract infection? Most commonly, there are a variety of things, but most commonly, you may see yourself urinating a lot more frequently than usual for your nature. There are people who take a lot of water and therefore urinate more frequently. Now, sometimes there's a confusion between am I urinating more frequently because I drink a lot of water or because of disease? For those who are in the habit of drinking water a lot, even them have a particular pattern. They know, for instance, that if I drink this amount of water, I urinate this number of times every day. Now, if you drink the same amount of water and you see yourself urinating much more frequently than you used to, that may suggest that you have contracted urinary tract infection. Now, the other symptoms that come with urinary tract infection is painful urination, some form of discomfort or maybe pain while urinating. Sometimes the pain comes in the initial part of urination, in the before the first few drops of urine comes out. Sometimes in the middle, sometimes at the end of urination. Whichever way, however it forms, once you have some kind of pain while urinating, it may suggest we have urinary tract infection. Then the other thing that may also happen with urinary tract infection is blood in the urine. Now, blood in the urine can be very frank blood. The individual just sees blood while urinating. Sometimes it's not frank blood, a little blood that will change the color of your urine to maybe kind of thick yellow or light red. So once you see changes in the color of your urine, and you know that, well, whether or not you have pain while urinating, whether or not you have frequency of mutilation, then it is important that you go and check out and see whether it is blood in your urine, because that may signify urinary tract infection. So by and large, those are the common things that people may observe or notice when they have urinary tract infection. How do we treat urinary tract infection? Of course, the first thing we need to do is to make appropriate diagnosis of that foundation. And how to make the diagnosis? Having listened to you, we take the urine in particular for analysis for culture. Now, I want to emphasize that for both males and females, it's not necessarily first urine of the day or early morning urine that we need to make a diagnosis of urinary tract infection. What is required in most cases when we want samples for urinary tract infection is what we call midstream clean catch urine. What this means is this: if you're a woman in particular, it's more difficult to actually collect samples without contaminating the sample, that is urine sample, without contaminating. So for women in particular, what we advise is this: is you'll be given a bottle, which should be sterile bottle. That bottle, you open the bottle when you are about to ease yourself to urinate. Now try as much as possible not to allow the bottle to touch your body. And when you collect the urine, you allow the first stream of urine to pass. Somewhere in the middle, collect the urine. You mustn't fill up the bottle. The little drugs or few milliliters of urine you collect in the bottle is more than enough, usually for cautious. And then also don't collect the last stream of urine. So midstream clean catch. Clean catch meaning don't allow the body and your body. The reason for that is our skin is inhabited by various microorganisms. We sometimes may drop into the bottle and could be cultured as the reason for urinary, and which is wrong. So sometimes when that mistake is made, or if that mistake is made, even when you don't have urinary tract infection, you'll be diagnosed as having one. And the organism that dropped into the urinary to the bottle is what they cultured, and that is what will eventually clear. Therefore, we are going to clear the organisms that normally should have protected you as your normal commensals. So basically, once the organism is identified, and then the appropriate antibiotics are given. Of course, we find out that they have a cure. So in summary, urinary tract infection, it's commoner in women than in men for the reasons I had mentioned earlier, and the symptoms usually are either you're urinating too frequently, or you have certain pains when, or some discomfort or pain when you urinate, or some blood sometimes. And once you have any one of these symptoms, it is good that you go to appropriate places and get treated. Please, I want to emphasize again that urinary tract infection is not the same as sexually transmitted infection. So if your partner has urinary tract infection, you don't have to be treated, except if both of you have had it from different sources. So thank you very much.